Hi guys. Hi. Today I'm going to talk about hemorrhoids. Hemorrhoids, the reason I've decided to talk about hemorrhoids is because hemorrhoids are the most uncomfortable thing that many people are experiencing, and they don't talk about it just because of where it's located or where it's found. So today I'm going to talk about hemorrhoids, and I'm trying to see if I can put down um, precautions or preventions. So, what are hemorrhoids? Hemorrhoids, first of all, hemorrhoids are veins or blood vessel within the walls of the rectum and anal canal. They are also known as piles that occur when these veins become swollen and the tissue around them becomes inflamed. So a swollen vein inside the canal is called internal hemorrhoids. And a swollen vein outside the canal is called external hemorrhoids. Hemorrhoids, most people have hemorrhoids, it's only that they don't talk about it. It's embarrassing, and people feel even embarrassed just going to the doctor to take care of them, so they just keep to themselves. They don't talk about it. That's why I thought I should talk about hemorrhoids. So I'm going to mention a few ways of preventing or treating hemorrhoids at home. So most doctors will tell you, oh, if it's not painful, it's better to keep it or exercise the hemorrhoid. Which means you swing it around. So when you go to the doctor either they're going to do banding, but this banding doesn't apply to the external hemorrhoids. It's only the internal hemorrhoids. And the doctor says that it's the most painful surgery you can go through. So that's why in most cases they will tell you to just keep it, because it's harmless, I believe, unless it's too much. So I'm going to talk to how to manage hemorrhoids at home on your own. First thing, before sitting on the toilet, apply the ointment where the hemorrhoid is located. So there's this ointment I'm going to put down in the comments which type of ointment is best for them and where to buy it. So when you apply the ointment, it makes it less irritating, especially after or during toilet. So the second preventive or precautions measure is you have to sit on the toilet the right way. You have to sit on the toilet correctly. It has to be a straight angle. When sitting on the toilet, it has to be a straight angle. Yeah. Thirdly, do not use tissue. It's good to use medicated wipes, or you can use water to pad the area after use of toilet, or you can take a shower if you have that time. Number 4 is if you have a protruding one, soak your butt in warm salty water. It helps. Yeah, it helps. That's you soak it from 10 to 15 minutes. Then the fifth one, apply ointment. And when you apply, swing it, like turn it around if possible. If not, just apply the ointment. Number 6, look at the consistency. In most cases, people get hemorrhoids because of constipation. So when you go to the long call, when you go to the toilet and you have these difficulties getting out the feces or the poop, you are experiencing constipation, and this is how most people get the hemorrhoids. Yes. So look at the consistency. You can prevent constipation by taking a lot of fiber, things like carrots or wheat. Yes, cereals, they're good with fiber. Hydrate yourself. Take a lot of water. Make it a habit of drinking water. It helps. It prevents constipation. Yes. So to take care of the discomfort when you have hemorrhoids, wear loose pants. Do not wear tight pants. They worsen the situation. And also when you put on tight pants, that's how you get the hemorrhoids, because of the pressure. People are used to putting on tight jeans. They are not healthy for anybody. This is how people get the hemorrhoids. So avoid very tight clothing, especially the pants. Another way is avoid sitting on the toilet so long. Like some people have a habit of when they go to the toilet, after they are done, they still continue sitting on the toilet, maybe making a call or reading a book or just relaxing. It's not healthy. Once you use the toilet, get off. Yes, get off the toilet. So decrease body lifting. That's number 10. As long as many people like going to the gym, body lifting, and heavyweight people lifting so many stuff, it's not really healthy. And when you do that, make sure you inhale and exhale. Yes, avoid that like you put a lot of pressure on the lower part of your body. Avoid that. Always get used to inhaling and exhaling, like, yeah, do those, they help. So if you practice all these precautions or management of the hemorrhoids, it will take up to 3 to 4 weeks for it to go away or get healed. If it doesn't, you can continue doing it. Do not get tired. Just continue practicing all these things, and it's going to help you out. It's going to help you prevent or make it less severe. So practice all these things and make sure you hydrate yourself, and this is going to lessen the pain or clear the hemorrhoids. So preventive measures of hemorrhoids hemorrhoids are a lifestyle, so you don't expect them to go away fully. Like, they might go away, they might not, if you take those preventive measures or healing process. So hemorrhoids can be prevented too, even though they are a lifestyle. You can drink a lot of water, one thing. Position yourself properly. Get off the toilet immediately you use the toilet. Avoid tissue. Get used to using baby wipes. Baby wipes are good. for you. Tissues are actually not very healthy, though that's what most people use. So avoid tissue, use baby wipes. Avoid sitting too long, especially at work. People who sit down, their nature of work is sitting down almost the whole 8 hours or 10 hours. Make sure after 2 hours you leave your chair and walk around. You can go to the restroom, you can go drink water or coffee depending on the nature of your job. So avoid sitting too long. Exhale and exhale any exerted pressure. So learn how to exhale. Do not just, like most people are used to pushing. When you're pushing, you are putting pressure on your lower part, which is not good, because that's how we get the hemorrhoids. So I'm going to mention medically what they do with hemorrhoids, especially when they are worse situations. So usually hemorrhoids, even if they go away, they will come back. Depending on what you do, they will come back. So it's not guaranteed that they will go away or completely. They might come back. So doctors perform hemorrhoidectomy. That is the surgery, the process to remove the swollen tissues or vessels. And this is recommended when your swollen vessels do not respond to more or the preventive or management, or let's say just conservative treatment. So the surgery is recommended, though the surgery is only for the internal, it's not for the external. So the side effects of hemorrhoids, they make you uncomfortable. It's the most uncomfortable thing, I think. Yeah, because it makes you itch, especially when there is even a very small dirt remaining in the area. It makes you feel like you want to scratch. So they make you uncomfortable, and sometimes there is bleeding, and sometimes just painful. So it's the most uncomfortable thing. But if you practice the precautions, preventive measures, you get comfortable and get used to them without feeling that much pain. And for the external ones, you have just to follow the instructions that I've mentioned. I'm going to put in the comments the link to the ointment and where you can buy them and exactly the name of the ointment. I hope I have shared a little bit of how you can take care of your hemorrhoids at home. Yeah, I hope I've not forgotten anything. And if there's anything you need to know more about the hemorrhoids, you can write in the comments. I'll be glad to do more research and answer to your questions. And then I am asking you all, if you have not subscribed to my channel, please do comment, like, and subscribe, and press the bell so that you can get to see the next video I'm going to upload. I'll do another research and share something else that I feel people out there really need the information. So thank you guys for watching this video. Subscribe and like it. Yes, subscribe and like it, comment, ask questions. And thank you so much again for watching this video. See you in the next video. Bye.